All right. Well, thank you everyone for joining us for this month's Wednesday webinar. I'm Shannon Dill. I'm with the University of Maryland Extension. And we offer these the second and Wednesday of each month on a variety of topics. So last week, I think we were talking about family finances and resiliency. And this session is about calf care. So we're really excited to offer such a wide range of educational opportunities. And with that, I'm going to turn it over to Dr. Sarah Potts. She's our beef and dairy specialist for University of Maryland Extension. Sarah?
All right, thank you. So as Shannon said, we're going to talk about calf care, some basics today, and we'll go through. And then if you have questions, please put them in the chat, or at the end you can unmute yourself and ask. We're pretty informal. So why is calfhood so important? Well, that's because calves, especially newborns, are really susceptible to a lot of stressors. They're going from that internal environment in their mothers, and they're going out into the world. And these stressors that they encounter during this period can have lasting impacts on their performance. So exposure to diseases, parasites, and temperature stress can have profound impacts later on. And these events can set the stage for the rest of the animal's life. So we're going to spend a bit of time talking about the first 24 hours after a calf is born, because that's one of the most critical times in its life. And the first thing we're going to spend a little time on is something called colostrum. So if you're not familiar, colostrum is the first milk that the cow produces. It's rich in antibodies, proteins, and growth factors. It's really important in helping the calf develop its immune system because the calf is born with basically very little immunity to anything. So it needs those antibodies that are produced in that colostrum to develop immunity. Once the calf is born, its ability to absorb antibodies begins to decrease dramatically. So this figure over here on the right is showing the antibody absorption rate of a calf according to its age in hours. So as soon as the calf's born, you see a dramatic decrease in the absorption rate of those antibodies in the colostrum. And you can see at this 12-hour mark, a very significant portion of that ability to absorb antibodies has been lost. And at 24 hours, this is pretty much the calf really basically loses its ability to absorb antibodies at that point. So the old recommendation used to be to make sure your calves get colostrum within 12 hours of birth. Obviously, from this figure, you can see that we need to move that recommendation up. And so new recommendations say we want to make sure they're getting it within 4 to 6 hours after birth. Inadequate colostrum consumption can lead to a poorly developed immune system later on in the calf's life. So they're more predisposed to scours or diarrhea, respiratory diseases, and general unthriftiness or poor health. So colostrum really is important in terms of long-term performance of the calves. This figure is just showing a study that was done a couple of years ago with dairy calves, showing how early colostrum delivery impacts the ability of the calf to develop its immune system. So they looked at antibody levels in the blood according to 3 different treatments. So they fed the calves colostrum right at birth, or they fed them colostrum right at 6 hours or at 12 hours after birth. And you can see they saw a significant increase in antibody concentration for those calves that were fed colostrum right at birth. And that difference was maintained throughout the first 48 hours of calf's life. They didn't see quite as much of a difference in those calves that were fed colostrum at 6 versus 12 hours after birth. There really wasn't much of a difference in terms of their antibody levels in the blood for those 2 treatments. So the take home from this slide is that early colostrum consumption is critical and earlier is better. So we want to make sure that we're closely monitoring our cows that are close to calving, because we want, for a number of reasons, but one of those reasons is because we want to make sure that our calves are up and nursing and consuming colostrum. Calves should be up and nursing within 4 hours of birth. Obviously we don't all spend time, watching our calves 24/7. So, if you're checking your cows, a couple of times a day, you want to make sure that you look for signs of nursing, that the calf has been up and nursed. One of the signs, obviously, is active nursing. You could also look for clean or slick teeth on the cow. If she has matted hair or saliva around her udder, around her teeth, or if there's 1 or 2 teeth that look smaller than the others, that's a good indication that the calf may have nursed. You also want to look at calf disposition. So if the calf is vigorous, if it's up and standing or running around the pen or the field, there's a good chance that calf has been up and has nursed. A calf that appears lethargic or weak within that 4 to 6 hours after birth probably hasn't really nursed well. And at this point, you should step in to intervene to some extent. Calves that have endured a difficult calving or dams who are thin or dams that are first calf heifers may require some assistance or supplemental colostrum. And that's because a cow that's down, who has had a difficult time calving, she might not have a lot of colostrum in her udder. She might not have produced enough. And first calf heifers generally don't produce a lot of colostrum or as much colostrum as their mature counterparts. So in those situations, those calves might require assistance. So sometimes things happen. So what if the cow won't let the calf nurse? Maybe the cow is rejecting the calf, doesn't want anything to do with it, or maybe it's the first calf heifer that doesn't really know what to do. You can try to get the cow to accept the calf. The best way to do this would be to restrain the cow and help the calf nurse. You want to make sure that you are restraining the cow properly to ensure your safety as well as the calf's safety. A chute works really well for this, and securing the cow's back leg is helpful sometimes to prevent it from kicking away the calf or kicking at you. A chute with an opening side panel can be really helpful for this type of procedure. It's a good idea to keep the pair separate from the rest of the herd, so putting them in a special pen or something like that for a few days to encourage them to bond, but that also helps you pay a close attention to them and monitor them closely and ensure the calf is nursing. If necessary, you can keep assisting several times a day until the cow hopefully accepts the calf. During that first 24-hour period, though, if a successful feeding isn't established by that 4 to 6 hour mark, again, it's important to step in and make sure the calf gets the colostrum. You can continue working with the cow to accept the calf, but again, it's important to make sure that the calf gets the colostrum regardless. You might run into a situation where the calf can't nurse. So maybe there's been a difficult birth, the calf is lethargic, the cow refuses calf, as I just mentioned, or maybe in some instances the cow has died or it's injured for whatever reason. If the calf can't nurse, step in and feed the calf the colostrum, either from a bottle or an esophageal or tube feeder, which I'll discuss just now. So the tube feeder you may or may not have encountered. The tube feeder there's a couple of pictures here, different types of tube feeders that are available, but the goal of the tube feeder is to deliver nutrients to the calf. There are 2 instances that we oftentimes will use a tube feeder, and those instances occur when the calf won't or can't nurse from the cow or the bottle. So you might consider using a tube feeder in that first 24 hours to ensure colostrum consumption, but you also later on in the calf's life, if it's dehydrated and you want to administer electrolytes or something like that, you might consider giving electrolytes with a tube feeder in that situation. But we're not going to talk about that today. We're mostly talking about our colostrum. So what do we give through a tube feeder? Obviously, if you're giving colostrum, you're feeding either colostrum or a colostrum replacer, or if you're giving it to a dehydrated calf, you're going to be giving it an electrolyte solution. There are different types of tube feeders, as I mentioned. They can have a bottle or a bag on the end. They can have a plastic probe or a metal probe. This is what the metal probe looks like up close, but the probe is very smooth on the end so that it doesn't injure the calf when you put it down its esophagus. So I'm going to give you a quick step-by-step on how to use a tube feeder. If you're interested in learning how to do this, I recommend working with someone who already knows how to do it and they can show you firsthand. It's nice to watch videos and things like that, but for me personally, I really appreciate being able to be taught hands-on how to do things like this. But the first step is to inspect the feeder, make sure it's clean and free of damage. If it's damaged, it can prevent proper delivery. If it's not cleaned, it can introduce harmful bacteria to the calf, which kind of goes against what we're trying to do by giving it colostrum that's supposed to help its immune system. So the second step is to prepare the solution. So if it's colostrum or colostrum replacer, you want to make sure you have enough mixed together or thawed out. And then if it's an electrolyte solution, you want to make sure that it is mixed appropriately. And again, that's only for calves who are having issues with dehydration later on, not during that first 24-hour period. This third step would be to secure the calf, make sure it's a safe environment for you. I generally recommend getting the calf into a pen away from the cow to protect yourself. Sometimes cows don't like it when you mess around with their calves. The calf should be standing in an ideal situation, or at least sitting up. So I like to back them into a corner that kind of keeps them from wiggling around too much while you're trying to place the esophageal feeder. You want to make sure when you insert the probe, you want to keep the nose of the calf in a natural position. You're not, lifting it straight up into the air. You can see in this video, the nose of the calf, when he first puts the probe in, is fairly level with the ground. You want to insert the probe slowly and gently, and the calf will swallow the probe and it should pass easily. And then before you start dispensing any liquid, make sure you check the placement of the tube. This is very important. If you will check the placement by feeling the side of the calf's neck. If you can feel the end of the probe easily, that means that you are in the right place. If you cannot feel the end of the probe, you're probably going to be in the trachea and you don't want to pour liquid into the trachea. So you need to try again. And it's important before you check your placement to keep the tube or the bottle or the bag or what have you kinked or below the level of the probe to prevent liquid from flowing in before you make sure that you're in the right place. The sixth step is to deliver the liquid. In this case, we're talking about colostrum. So you want to unkink the tube and raise the bag or a bottle above the probe to allow the liquid to flow. Don't worry if the calf fights. As long as you've checked proper placement, you're going in the right direction. And make sure you deliver the entire contents of the bag or the bottle. And then, of course, the last step would be to remove the probe. And when you do that, you want to make sure that the calf's head is in a neutral position, kind of the way it was positioned when you inserted the probe for the first time. That keeps, that keeps you from damaging the calf's esophagus. And then the last step would be to clean the probe and the bag to make sure that it's ready for next time. So sources of colostrum to have on hand if you have a cow or a couple of cows getting ready to calve, you want to make sure that you have a plan in place. You want to have a backup for a time, when the calf can't nurse the cow, or you don't have colostrum from the cow. So there are a couple of different options to have for your backup. You can obtain colostrum directly from the cow, but you must have the ability to restrain the cow and milk the cow. So that's not always practical for a lot of people. So the next best alternatives would be to either have stored frozen colostrum from another cow on hand. This could be a cow from your herd, which is ideal, but not always practical. Or this could be from another herd, and that could be a dairy herd or beef herd. And the third option would be to have a colostrum replacer on hand. This is different from milk replacer. It's a little bit more expensive than milk replacer, but it is a good option to have on hand if you don't have access to frozen colostrum from your herd or another person's herd. So how much colostrum should you feed? And if you find yourself in a situation where you have to feed it to the calf manually, the rule of thumb is 10% of the calf's birth weight. So if your calves are around 70 to 80 pounds at birth, that's between 3.5 and 4 quarts of colostrum. So we generally recommend, as a blanket recommendation, 3 to 4 liters or quarts within 2 to 4 hours after birth. So that first feeding, we want to give to them within that 2 to 4 hour mark, obviously at least by 6 hours. But as I mentioned earlier, the earlier you can give colostrum to your calves, the better. And then the second feeding, if you need to give a second feeding, if the calf isn't up nursing the cow at that time, ideally we would give a second feeding at 12 hours. But if the calf is up and successfully nursing it by that 12-hour mark, you don't need to give your second feeding at that time. If you're using a colostrum replacer, you want to make sure you're following the mixing instructions on the bag and deliver at least 2 doses of replacer, each containing at least 100 grams of IgGs or antibodies. So enough about colostrum. So some of the other things you want to address during that first 24-hour period is to make sure the calf is clean and dry. So the cow should lick the calf off and clean it after it's born. This stimulates calf activity. It helps to dry the calf and reduce cold stress. If you think about it, the calf is going from the inside of its mom, where it's about 100 degrees, and they're going outside. where sometimes it's anywhere from 40 to 70 degrees during calving season. So cold stress is a thing for calves, and so drying them off quickly is really important. If the cow can't or won't clean the calf off, or if it's really, really cold, you can step in with dry towels and dry the calf off, and then keep the calf in a dry, clean area protected from wind. If it's really, really cold, you can also use heat lamps if you would like, but just make sure that they're not touching the calf or the bedding, and always make sure you turn them off when you're not around. So if you have to run over to the store, or run over to your house, turn the heat lamp off. It's not worth the risk of your barn catching on fire. Something else we need to address during this time is disinfection of the navel cord. Once the calf is born, the umbilical cord is severed from the cow, but until that tissue dries up and falls off, it presents a direct route for bacteria to access the calf's blood system. So we want to make sure that we are disinfecting that tissue, especially if we're calving indoors or in a dirt lot where the likelihood of pathogen exposure is higher. We generally recommend using a 7% tincture of iodine, but there's also other navel dips that are marketed as navel dips or navel disinfectants that you can purchase. And you want to complete this within 24 hours. There are sprays. You can get this in a spray gun that you can spray on the navel cord, which some people really like. I personally don't like that because it's hard to ensure that you get full and complete coverage of the tissue. So I like to use a cup or some sort of like dipping reservoir that you can dip the navel, that you can make sure you immerse all of the tissue in. So no return teat dip cup works really well. This is just a cheap Ziploc disposable container. Just make sure that you clean it in between calves so you're not transferring potential pathogens between animals. Another thing we want to make sure we're doing right as soon as we can after birth is to identify our animals. It's important for good record keeping, which we strongly encourage. There are a couple different options. Obviously, the ear tag is the most common thing to do. Tattoo and freeze branding or hot branding are more permanent types of identification that you can do, but I don't recommend doing them right as soon as the calf is born. So ear tag is a pretty safe way to go after the calf is born. So some things to have on hand in the first 24 hours is a bottle, and then a bottle nipple is also important. I didn't really talk about this earlier, but we want to make sure that the bottle nipple is in an acceptable condition. We don't want it to have gaping holes. I know that makes the milk come out faster for the calf, but we really don't want that. We want to encourage the calf to actually have that suckling reflex and drink at its own speed. We want to make sure we have an esophageal on hand and at least knows and kind of have an idea of how to use it. And if you don't, then have someone that you can call to help you. You want to make sure you have colostrum on hand as a backup, so you can have some in the freezer or a colostrum replacer bag on hand. You want to make sure you have an ear tag or ear tagger so you can help identify your animals quick, as soon as we can after birth. A navel dip, and then we also want clean towels available. So things to look for in your calves during the first couple of weeks. You want to look at their behavior. So calves should appear vigorous, responsive, and alert. Those that are lethargic, or they're kind of dull, or they're isolating themselves, they really should be looked at. Perhaps they didn't get enough colostrum during that first 24-hour period. Maybe they're sick, maybe their dam isn't producing a lot of milk, but they definitely should be examined. If they have signs of scours or diarrhea, that's another thing to watch out for. So signs of that would be loose watery manure, or there may be manure caked all over the backside of the calf. Those would be things to watch out for. If they do have scours, you want to watch for signs of dehydration. So if they're not, or if the calves aren't nursing well, if they have scours, they can be dehydrated really quickly. And there are two ways to check for dehydration. You can look at the eyes. So in this picture here, this is a normal calf and this is a calf that's dehydrated. You can see its eyes are kind of sunken in a little bit. You can also perform a skin pinch test if you can get close enough to your calves, where you tense the skin, take a pinch around the neck area, and then you count how many seconds it takes for it to go back to normal. If it takes more than 5 seconds, that's considered to be a dehydrated calf that needs some attention. All right, so we'll go into a little bit about nutrition and feeding for our calves. And before we get too far into it, I want to address this issue of calf rumen development. So most of you probably know that the cow has a 4-compartment stomach, and that the largest compartment is the rumen. And that is the case for a mature animal. However, for a calf, when they're born, the rumen is really, really underdeveloped, and the predominant compartment is that 4th compartment, the abomasum, which is the true stomach. The abomasum is very similar to a monogastric animal. So when the calf is born, they are functioning very similarly to, like humans or pigs or something like that. So they can't really utilize a lot of forage because they don't have a developed rumen when they're first born. As they mature, though, the rumen starts to grow and develop, and then it starts to take over as the predominant compartment of the stomach. And obviously, by maturity, it is the predominant compartment of the stomach at that time. But the reason why I show this to you is because that helps us understand why we feed calves, or why calves are managed the way they are during those first few months. So during those first 2 months, calves receive most of their nutrients from milk, from their dams. And we want to make sure that during that period, the cows have adequate nutrition so that they're able to produce enough milk for their calves. So the way we do that to make sure our cows are being, meeting their nutritional requirements is to look at their body condition. So if you're not familiar, body condition scoring in beef cattle is from a score of 1 to 9. And we generally want our cows to be between this 5 and 6 range. Sometimes in that really early lactation period, right after calving, they're milking a lot. They might dip down into this 4 area, but you don't want your whole herd to be in this, to average at this 4. You might have a couple at the 4, but you really don't want the average to be a 4. If you're seeing cows that are looking a little thin, that might be a good indication to you that you need to either do some supplementation or do some sort of nutrition work for your cows. Calves during this time will start to nibble some available feed, so pasture, hay, things like that within a few weeks of birth. They rely a lot on watching others, on learning what to eat. So the herd behavior will encourage them to explore different feeds. This is a process that helps to initiate that rumen development, and it also introduces bacteria into the digestive tract to get the good microbiome kick-started. We want to make sure that during this time we're checking calves at least once a day to make sure that they're active, making sure that they are nursing well. If you at any time have calves with poor vigor or growth, or they're just not acting right, they're isolating themselves, that could indicate that they're either sick or that they're not getting enough milk from their dam. So that should be looked at a little bit more closely. So for 3 months to weaning, that rumen is starting to develop. So we want to make sure that calves are starting to have access to good quality pasture and forage, because they are going to start increasing their solid feed intake, which is good. We want them to do that as they get closer to weaning. Supplementation of solid feed is only necessary when pastures are in poor condition. So if it's the heat of the summer and things are real dry, it hasn't rained in a while, you might consider, your calves might require a little bit of supplementation at that time. By 3 months of age, calves should be consuming around 1% of body weight as solid feed. A lot of times this is pasture. And I only mention that because I know that we're not out there measuring how much our calves are eating, but I mention that because if you are, supplementing your calves or supplementing your herd in general, you want to make sure that you're putting enough out so that the calves have enough to eat as well. There's something called creep feeding that some producers elect to do for their calves, and that is basically providing a supplemental high quality feed. A lot of times these are high energy or protein mixes, creep mixes, or even sometimes high quality forage that only the calves can access, but the cows cannot. Creep feeding helps to provide that supplemental nutrition during the couple, month or two before weaning. So it's kind of a management tactic that some people like to use, but whether or not it's right for you really depends on a lot of things. But creep feeding can promote higher weaning weights and help compensate for poor milk production of the cows, which is good and bad. And whether or not you should creep feed really depends on a couple of different things. So, if your pastures are in poor condition, your cows are in poor condition, calf prices are high, feed prices are low, wishful thinking, and calves are being sold shortly after weaning, you might consider creep feeding. It might be worth it for you. It might not be worth it for you if your pastures are in good condition, or if your cows are in good condition, which indicates they're probably producing their milk, enough milk for the calves. If the calf prices are low, feed prices are high, and if you're keeping calves for a long period of time after weaning, creep feeding might not be the most economical for you. The decision really comes down to the potential for economic return. And to understand that, you need to know your feed costs and the value of the additional gain you might get from creep feeding in order to make that decision. So creep feeding is kind of a hit and miss thing for a lot of people. And I think some years it might be appropriate to creep feed, and other years it might not be, so it really just depends. Something else that some producers might elect to do before weaning is something called preconditioning. It involves preparing calves for the next stage of life. So usually this means preparing calves for the feedlot if you're selling them at the livestock sale. So basically what this entails is retaining calves for a period of time after weaning, so at least 45 days before you sell them. And during that time, that allows them to, one, get used to not, nursing off their dam, but also get them bunk trained, used to eating out of a feeder. It also helps them to adapt to solid feeds and water troughs, and also provides time for you to give vaccinations and then perform any other health measures that need to be taken care of, like dehorning, castration, things like that. Some of the benefits of preconditioning is that you do end up selling heavier calves, and there are sometimes additional premiums that you can receive at sale time. So whether or not you should precondition calves, as with creep feeding, it really depends. It depends a lot on economics. Whether or not you have a market for your preconditioned calves. Do you keep good records? What are your calves? What's your cost of gain versus price received? Can you afford the additional feed or grain that would require to, precondition your calves, things like that. Some facility considerations and labor considerations that are unique to your situation are also things that you should think about. Whether or not you have the appropriate facilities to accommodate the calves, if you have enough time or the ability to get enough labor to, dedicate to collecting records and observing animals and managing the feeding. So those are all things you should be asking yourself if you're thinking about the preconditioning program. And the last thing about nutrition I will add is not to forget about water. Obviously, water is the first essential nutrient because our bodies are made up of about 60% water. And access to clean, fresh water is important regardless of age, especially during the summertime. And early exposure to water troughs can actually help calves learn to use them during and after weaning. So it's good to get them used to that type of system before they're weaned. And we want to make sure that calves can actually physically access water. So if you are, if you have a couple of stock tanks and the water level gets a little bit low, sometimes the calves can't actually even physically reach the water. So we want to make sure that we're watching out for that. Again, this is important all year round, but particularly important during the summertime. All right, so we'll spend a little bit of time talking about some health things that we should be thinking about for our calves. And the first thing I do want to mention is this veterinary client-patient relationship. And according to the AVMA, it's the basis for the interaction among veterinarians, clients, and their patients, and it's important to the health of the animal. All this to say is that you should have a working relationship with a veterinarian or vet practice that is familiar with you, your animals, and your farm, and can serve as a primary contact if you have a health need for your animal. I know sometimes this can be difficult, depending on where you live. It can be hard to find a veterinarian who's willing to take on someone who has cattle, but it is something that's really, really important. You want to make sure that you have a good relationship with your veterinarian so that when there are issues like a difficult calving or a sick calf or a severe injury or something like that that you can't handle on your own, that you are comfortable calling them for advice or assistance. And obviously, if there are routine care procedures like vaccinations or castration, dehorning, things of that nature, you want someone available to help you with those as well. There are a couple of tasks that sometimes need to be addressed in our calves. The first one I just want to briefly mention is dehorning. The reason why we dehorn calves is that horned cattle pose a safety risk to humans and other animals, and you can endure some sale barn discounts if you send animals with horns to the sale barn. When do we dehorn? Before 2 months of age is recommended. The earlier, the better. The earlier you do it, the less traumatic it is for the animal, the less damage it is to the animal. And there's a couple of different methods for doing it. Caustic paste and hot iron cautery are the most common. But in the beef industry, if you are using any kind of Angus genetics, you are lucky because the Angus breed is polled, or they're naturally hornless. So if you incorporate Angus genetics or other polled breeds into your breeding program, those calves generally won't grow any horns, because the polled trait is a dominant trait. So fortunately, a lot of our beef producers have utilized these types of genetics in their breeding program. So dehorning isn't a huge concern for a lot of our producers. But every now and then you might have a couple of calves that do have horns because they are sired or are sired by an animal that did have horns. So again, if you ever need to dehorn, you should get in touch with your vet. They can help you with that process. Another processing type of management is called castration. So that is removing the testes from the intact males. Why? Because bulls can be really difficult to manage from a behavior standpoint. They tear up fences. They can be aggressive. We don't like to deal with that. And also in terms of management, it can be difficult to manage your calves as a group. So if you're keeping them after weaning, if you don't castrate your males, you generally can't run them with your heifers after a certain period of time because they will interbreed with each other. So how do we castrate? There are several different options. The most common is banding or the Burduzzo emasculotome. And when to castrate, again, as a dehorning, we want to do it as early as possible because that does limit the stress that it puts on the animal. So this figure is just showing the change or the decrease in body weight gain that we see according to age at castration. So as you can see, as age at castration increases, you see a much more dramatic reduction in growth as the animal is older. So we want to make sure that we're doing it as early as possible. And again, if you want to learn these procedures yourself, it's important to work with your veterinarian to learn proper techniques so that you're doing it appropriately for the animal, but also making sure that it's done right so that you don't end up with an animal that is not really castrated when you thought that you actually castrated them. The next thing I just want to mention is vaccination. For calves, we generally recommend a couple of different vaccines. We oftentimes recommend people give vaccines before weaning, several weeks before weaning. We don't want to give them their first dose of the vaccine right at weaning because if they're right at weaning, they're already a little bit stressed out through the weaning process, and they might not have a very good immune response to those vaccines. So some of the vaccines you recommend are Clostridial or blackleg vaccine, BRSV, IBR, and Mannheima pastorella. So there's also vaccines for pink eye that you can utilize as if you feel the need to do that. But those top four are the ones who recommend giving regardless. All right, on to weaning. So some things to consider about weaning is that weaning is a major, really stressful time for a calf. It involves two major stressors. We're removing its primary source of food, its milk, and we're also taking away, separating the cow from the calf. So we want to avoid combining weaning with other stressful procedures like introducing them to new environments, sending them to the sale barn, vaccinations. We want to avoid compounding that weaning stress. So we want to ensure ample access to high quality palatable feed during this time. And we also want to make sure we're looking in on our calves for normal signs of behavior and signs of dehydration on a regular basis, at least once a day, if not a couple times a day. Before weaning, we want to administer pre-weaning vaccines to our calves. Again, as I mentioned earlier, several weeks before weaning, that's when we want to give our first round of vaccines. We also want to try to familiarize their calves, feeders, waters, and their post-weaning environment. We want to move the cow-calf pairs into a field or facility a few days beforehand. And then when you go to initiate the weaning process, remove the cows from the calves and not vice versa. And that way the calves are already in an environment they're already familiar with, and then you're just separating the pair. You're not introducing them to a new environment and separating the pair. And we also want to ensure access to minerals and vitamins to support immunity during this time. There are a couple of different weaning strategies that are used in the industry. The first is traditional weaning, which involves complete abrupt separation of cow and calf. This process will induce a lot of vocalization and fence line walking for both the cow and the calf, but most of the calf, for up to 3 days. And sometimes this weaning strategy is combined with chipping. So they take the calf off the cow and send it right down the road to the sale barn. This is really not recommended if you can avoid it. Again, that's compounding stressors on the calf, and it can be really hard on the calf. One of the alternative weaning strategies that some people do practice is something called fence line weaning, where calves are separated from the cows by a fence for 5 to 7 days, so they can still maintain that visual and auditory contact with their dams. And then at the end of that 5 to 7 day period, you would basically separate or move the cows to a different field or paddock where they can't actually see or hear their calves. Compared with traditional weaning, this strategy produces less vocalization, less fence line walking, and better gains. So that would be an indicator that it's a little bit a less stressful process, weaning in this way versus the traditional way. Obviously, this not everybody is set up to do this. You need to have the proper facilities. You need to have a good, strong, permanent fence that will be separating the cows from the calves. Otherwise, you're not going to have success in keeping them separated. One of the other weaning strategies is something called two-step weaning, which involves separating the stress of cow-calf separation and milk separation. So you're not doing both of those things at the same time. You're kind of separating it out and making a more gradual process. So this process utilizes a plastic nose piece in the animal, which is shown here in this picture. It's a temporary device that is inserted into the calf's nose, and it has spikes on it so that when it goes to nurse the cow, it pokes the cow and the cow doesn't let the calf nurse. So that basically stops them from nursing before you separate them, and it allows them to remain with their dam for 1 to 2 weeks before you separate them completely. Compared with traditional weaning, there's a bit less vocalization and less fence line walking. However, there's not really any consistent advantage related to growth benefits of this strategy versus traditional weaning. So, but again, in terms of appearances of stress on the calf, it seems that it's a little bit less stressful than traditional weaning. There is the added cost of the nose pieces. If you go this route, they're anywhere from $6 to $30. And you do need to check the calves each day to make sure that the piece is still in place, because they can fall out. And that does require a little bit extra handling, because you do have to run the calves through a chute or restrain them in some way to put the pieces in their noses the first time. So it's a little bit more involved than a traditional weaning approach, but it can be an alternative to that traditional approach. Before we wrap up, I just want to address this issue of orphan calves. In the unfortunate event that you find yourself in a situation where you have to raise the calf, either the cow won't take the calf, or something happened to the cow, or you went to the barn and you bought a couple of calves and you just want to raise them by hand. I just want to address some considerations for that. So when you feed an orphan calf, generally you're going to be feeding them a milk replacer, which is kind of like infant formula if you're not familiar. And you're going to be feeding that 2 to 3 times a day from about 1 to 2 days of age until you wean them, which you can start to initiate that process, anywhere after 6 to 8 weeks. During that milk feeding period, you want to provide daily access to fresh water and grain. So this grain can be a pelletized or a texturized grain. Either of these would be appropriate. Something real fine isn't necessarily recommended, but a pellet or some sort of texturized starter is fine. The goal would be to get our calves eating at least 1.5 to 2 pounds of solid feed or grain before they wean. I know it seems a little strange to be feeding them grain when we're talking about calves that are on their dams. They're starting to eat grass and forage and things like that. But grain consumption really is important to helping initiate that rumen development early. So it helps to jumpstart that process so that you can wean the calves a little bit earlier if you choose to. So if the rumen's not developed enough, the calf can't be weaned from the milk. So we want to make sure we're feeding our calves. We're going to use a bottle or a bucket. So most people would just choose to feed it with a bottle, because if you only have 1 or 2 calves, it's not really worth your time to train them to drink from a bucket, but either is appropriate. There's really no effect, growth, benefits or negatives for either situation. And then when you're mixing the milk replacer, you want to make sure you're following the instructions on the bag for feeding rates, and use warm water to mix the milk replacer. Cold water doesn't really mix very well, and the calves generally sometimes will like to prefer warmer, a milk that's warmer. And you want to make sure that after you're feeding the milk replacer that you want to clean anything that touches milk replacer after each use, because milk is a breeding ground for bacteria. So we'll make sure that everything is cleaned up afterwards. And if any time the calf doesn't drink all or most of its milk at a feeding, you need to check it out for signs of illness, because going off feed is one of the first signs that an animal is not doing well. So in terms of housing for our orphan calves, we want to house them individually or with other orphans of similar size. We don't want, one itty bitty calf in a pen with really big calves. We want to make sure that that housing area is dry and well ventilated, but also protected from wind, rain, snow, and predators. So we don't want it to be super windy, but we don't want it to be in a tightly enclosed barn where it's, some very stale air and things like that, because that can promote respiratory diseases. We want the bedding to be, again, dry. A lot of folks will use sawdust, straw, or hay. Anything like that is fine. Common structures for individual or orphan calf group housing is a barn, a calf hutch, a makeshift gate pen works fine as long as there's still protection from the elements. So anything like that would be fine. And we do want to make sure that we're providing access to fresh grain and water each day. So changing out that water bucket, changing out the grain every day still is important. So with weaning a bottle calf, it's a little bit simpler than it is in terms of than it is relative to weaning our calves from their dams. Usually around 6 to 8 weeks of age, if the calf is eating 1.5 to 2 pounds of grain a day, they can be weaned at that time. Some people don't mind feeding them a little bit longer, but milk replacer is expensive, so I understand the push to wean them a little bit earlier. To initiate the weaning process, we want to decrease to 1 milk feeding a day, and then at the end for a week, and at the end of that week, remove all milk feedings at that time. And then after weaning, we can commingle them with other calves of similar size, or with the cow-calf herd. This needs to be done with care. We want to make sure that those calves are still thriving after they're intermingled. We want to make sure that they're acclimated to their new feed, water source, and environment before we, really throw them to the wolves, so to speak. We want to make sure that they're able to fend for themselves. So you want to make sure you're observing them closely especially during those first few weeks after you intermingle them, to make sure that they are doing well and not falling behind or getting dehydrated or things like that. So some final thoughts before we wrap up. There is no one-size-fits-all management system. So every farm is different. Every producer has different goals. So it's important to do what works for you and fits with your goals. There are 2 major critical times during a calf's life, and that is the first 24 hours and weaning. And we want to make sure that we're checking our calves and cows at least once a day, if not more frequently during some of those critical times like calving time. We want to make sure that our animals are eating and drinking, and we also want to make sure that they are behaving normally. So with that, I will wrap up, and if there are any questions, I would be happy to take them.
Thanks so much, Sarah. That was great information. I don't see anything in the chat pod with questions. And just a reminder that these are posted online, and then we'll be sending out the recording as well as the slide set. And I'll go ahead and stop the recording.